we're really, really pleased that councillors Teresa Murray and Dan Watkins are able to join us. Teresa, as many of you will know, is the Deputy Leader of Medway Council, Chair of Medway's Health and Wellbeing Board, and Cabinet Portfolio Holder for Health and Adult Services. Councillor Dan Watkins, Cabinet Member for Adult Social Care and Public Health, and has a huge role across Kent and Medway to move this conversation on. In our planning for this session, we thought perhaps a conversation between the three of us might open up opportunities for Teresa and Dan to share their thoughts. So I hope you are both here, Teresa and Dan. Thumbs up.
I'm here, Sedi. Thank you. Hello,
which
Dan.
Is absolutely great.
Myself also.
Thank you so much. Can I perhaps start by just an open question, really, to get your thoughts on what you've heard so far today? Much of it, I'm sure, will not be a surprise, but you may have heard one or two things that have made you think in terms of discussions that you have with colleagues. I hope you won't mind, Dan, but let me invite Teresa to kick us off.
That's ever so helpful, because actually I am very short of time this morning for a number of reasons. A domestic reason, having a gas leak, and I'm pleased to say that in this very room with me now I've got Councillor Vince Maple, who I've just updated on what a good morning that we've had, and we've got something to do immediately. So first of all, it was lovely to see everybody. I thank particularly Alice. It was really nice to have a chat with you before this meeting to talk about the Centre for Healthy and Empowered Communities, and I want to pay tribute to the centre and their previous work, apart from the relaunch today, and in particular to thank them for the support that they've given to our research in Medway for the health determinants research collaboration through the university. And I know, Alice, you and others have been very involved in that, and that's important. I said at the beginning today that research and development is absolutely crucial to the way that we move forward. That if we're going to be accountable for things, we have to have the evidence to support that accountability and the reasons that we say we need to do things, in particular for you, Sedi, for making sure that we get the funding where it needs to be. And I was particularly inspired by what Toby Lewis had to say this morning, because it accords with what Michael Marmot says, and that is, it isn't always only about having more money, although sometimes it is, but it's about how we use that money and where we direct it towards where the evidence is telling us it needs to go. So I had sort of confirmation of some of the thinking, Sedi, that you and I and Dan as well, you know, through the ICB have done together about the way that we tackle these terrible, persistent and very pervasive health inequalities. What I take away from today is, yes, we can do more research and development, and we can do it together. I thought what Toby told us about the fact that we're overweighted with data was incredibly important, and that what we have to do is use the data that we know is going to make a difference to the research we want to do. So that kind of impactfulness agenda, I thought was incredibly important. And I was really interested in what he said about anticipating where we're going to get problems. I said in the chat this morning, I think there's some organisational dishonesty about that. The example that Toby gave of saying if someone's having their water cut off, that tells us that they're in trouble. That tells us immediately that whoever that is happening to is going to have an impact on health. So it's not just about partnership, it's about that collaboration and sharing of what's going on within our organisations to tell each other where we think problems are, where we think problems are going to be. And I think that's a new lesson crystallised for me today that I'd really, you know, like to think about taking forward. And that involves us not just in the organisations that can help us with the wider determinants of health, like housing and getting decent green spaces. It involves the DWP. It involves the utility companies. It involves transport companies. You know, if we'd ever heard this morning how we need to bring all of those things together to make sure that people can live the longest and healthiest, best life that they can. I don't think we need any more evidence like that. So that was something I really took away from that, and the fact that partnership is not enough. We're good at saying we're in partnership. We're good at being in partnership. I'm really good at coming to meetings with you, Sally, and Dan being there as well. But I want to be better at making sure that there's an impact from those meetings. And I was really pleased to see everybody from all the different organisations today. I'm sorry I can't stay and chat, but I know that we will in the future. I'm looking forward to Alice's big idea, and I like calling it that. That's a great title. Alice's big idea for taking things forward. But I'm afraid, not just because of the general election, but loads of other things absolutely have to go. But I was very, very, very grateful to be here this morning. Thank you, everybody.
Thank you, Teresa. Thank you so much indeed. Dan, your thoughts? I mean, clearly it's now thee and me, you and I. So just your thoughts.
Yes, thanks, Eddie, and thanks to everyone who spoke before. It has been a very illuminating discussion, and of course I've only been in this role for 9 months, so I have still got a lot to learn. Actually, I thought my comments might be on the sort of general theme of entrepreneurship, which might seem a little left field, but I shall explain why. And actually, as a starter, Eddie, you know me, but I don't know Toby or Hillary from before, well, I know some of the excellent VCSE organisations on this call, but many of you I don't. But by my background, actually, I am an entrepreneur. I come from the commercial sector. I've done 20 years of that before I became a counsellor. So I kind of have a background in starting up organisations and growing them fast, with all the fun that comes with funding and operational management and selling your vision to the world. And actually, I thought there were some great insights that we've heard along the way. So Hillary talked about disruption, which actually you and I said he talked about in our very first encounter, and that's exactly right, because if we're going to go from a world where virtually all the money is spent in sort of reactive health solutions to a world where we start tackling things sort of further up the let's call them health supply chain and be preventative, so take action early before bigger problems arrive later, then that does involve a disruption. And actually, anyone involved in entrepreneurial endeavors, we're all sort of hardwired to think about doing things differently and not just saying, well, we did things like this for 100 years and therefore we carry on doing them like that. But of course, disruption is very, very hard. And Toby made a sort of another kind of link back to this kind of entrepreneurial side of things, which is that, maybe if we did 10 interventions, we would find that only one of them succeeded. And in the commercial sector, he's absolutely right. That is fine, because if you go to a venture capital firm, they will fund 10 entrepreneurs to try and bring their product to the world, and they are happy to make their money on the one that succeeds, even if the other 9 don't. And there's a kind of business model there, but that does not translate very readily into our world of public sector, community sector partnership working, even though there is a bit of private sector in with us as well, in terms of what HEC is trying to do and what all of the great social entrepreneurs who are on this call are trying to do, because that's what really community groups we're all social entrepreneurs. That's what we're trying to kind of navigate through, and in a way bring some of that together. I think in some ways it's the system kind of wants us to sort of operate in an entrepreneurial commercial way, but we're not in the commercial sector, and that causes some of these challenges, like we only get funding for a couple of years, right? And we have to deliver in that timeline, whereas actually setting up a business, if you get a good financier behind you, they will actually give you quite a lot longer than that to deliver, and they will be more receptive to the fact that you might fail, and you try and learn from that. But I think equally, to take some sort of positives, as I kind of maybe draw my opening comments to a close. I think one good thing about our community here and what we're trying to do is, we do have funding for research, and actually in sort of private sector entrepreneurship, so you don't really get research paid for, from third parties. You have to fund it yourself. And what does that mean for a small business when it's starting up? It means it doesn't get done. As entrepreneurs, we're making decisions based on gut feel a lot of the time, and a little bit of research we might be able to get off the internet, and a few customer surveys. But we do have that as a strength, so we can be more research led, and because we have to justify obviously taxpayer funding, we should be more evidence based in everything we do. So we have organisations, here in Kent, it's HEC doing the great work that Alice is leading, trying to get that funding for the research to really help evidence all of these social interventions. And at least when we do fail, we can learn from it, and maybe not to do that again. Whereas again, in the private sector, frankly, that knowledge, once an organisation, once a business has failed, it's gone, right? The mistake might be made again. So actually, we're a little bit maybe more collaborative and working together, which means that we operate in a sort of environment where I think that knowledge can be kind of captured and shared a bit better than you might see in the commercial sector. And I think one other thing just to flag is tech. Tech can transform everything. Private, public sector, third sector. When we talk, because we have done a lot when Toby and Hilary listed some of the projects they've been doing, research-led projects, they are analysing data, and they are looking at the cohorts of people and individual people and families who need help early before the problem materialises. And with all the algorithms and artificial intelligence now coming to the fore, we've got a huge opportunity. And you have to look at places like Norfolk County Council, who I met with a few months ago, where they are analysing their databases and saying, these are the families, these are the individuals, the frail, vulnerable people who are most likely to have a trip, and putting the intervention before it's happened. It's so good for people's outcomes, and it saves the system a lot of money and actually a lot of capacity. So I think tech is another good example. We touched upon that a little bit earlier today.
Dan, thank you very, very much indeed. And thank you for reminding us all, and for those people who haven't heard for the first time, and to spare your blushes, to share with colleagues that Dan is a very successful entrepreneur. One of the big challenges I believe that we have, and this is where I would like the Centre for Healthy and Empowered Communities to really flex some muscle, is to start engaging the business sector across Kent and Medway, recognising that many will be SMEs and limited in terms of time and so on and so forth. In this conversation, I've spoken to the Chamber of Commerce, and I've argued that, for example, it's in businesses' interest to have a healthy workforce, more productive workforce. They don't maybe have time to analyse. If we analyse the level of sickness across the business sector in Kent and Medway, we might well be surprised. How do we, and dare I say, not wishing to be presumptuous, but engaging with the other parts of our ecosystem, the voluntary sector you've mentioned, we always feel we're pushing an open door. Education increasingly are coming into the conversation with young people's mental health and so on and so forth. Housing, I'm not sure Chris is still here, but Chris Giles, very engaged in the role housing can play in improving people's health and well-being. We've heard about damp homes and so on and so forth. But engaging with the business community, I think, is perhaps a greater challenge. Do you have any thoughts as to perhaps how we collectively can do that, or should try to do that, Dan?
Yeah, you're right, Sedi, that it's one of those million-dollar questions. If we can get the business community more engaged on this agenda, then it will lead to some great things, because ultimately businesses will pay organisations to deliver services which help that business achieve its aim. And indeed, think about my own business. We've got a few hundred staff. We pay organisations to provide like a mental health helpline to all of our staff, and many other sort of interventions, which actually some of the great community groups that have been referenced today and spoken on this session have talked about. So I think that can be part of the solution, because where funding comes from a business to an organisation providing that kind of support service to staff, then you can deliver. The organisation can develop kind of innovative services around that funding. I think maybe one of the challenges, though, Sedi, is that often people on this call are used to dealing with a cohort of people who are, some of them maybe unemployed and some of them just doing relatively low skilled employment. And I think the businesses involved, even in the low, obviously businesses aren't really involved in terms of employing unemployed people, obviously, but even for employing lower skilled people, I don't think they've maybe got their head around the idea that quite a big significant intervention might be needed. All those things you talked about, housing, etc., housing, health, etc., to get that worker to the best place and to be the most productive, productive they can be. So I suppose what I'm saying is the barrier, I think, is the cohort of people who need these interventions. Often the problems are very knotty, therefore the interventions are relatively expensive. So yeah, there's obviously that programme of work you're well aware of that Kent and Medway are doing through the integrated care system with various employment related agencies that will support those people into work, and that may be quite a good starting point for what can be done in that field. But I think you're right. I think there should be some work done on this, because that is one stream of funding into the sector that could generate some brilliant outcomes.
Very much so. I'm not suggesting for a moment that employers adopt some of the practices that have been used in America as a way of trying to tackle the high levels of obesity amongst American people, where some employers have linked pay rises to weight loss, for example, because just in terms of incentivizing their workforce to lose weight because they are less productive because they're obese. I'm not suggesting that for one moment, but of course the relationship between an employer and its member of staff, and we've seen that over the years, can drive productivity, organizational culture can be improved, improve staff retention, recruitment, and so on and so forth. So I think a big part of the centre's work going forward, through Alice and colleagues and myself, will be to start really knocking on doors of businesses in Kent and Medway to say, get on board, there's a lot of great work going on. You employ people in Kent and Medway, we want your support and we want your help. Then I'm just conscious of time. There's one more question which is not meant to be unfair at all, but I'm very conscious that as a counsellor, you will speak to hundreds of people every week in your surgeries. I'm guessing in your community, people know who you are now, and they'll stop you in the street or in the supermarket. What are the messages that you're hearing, Dan, in terms of what are people looking for from us and others like us?
I think it's fair to say, we live in quite stressed times, and so the messages are that the people do want help. But I think there is a recognition that just the traditional NHS is unlikely to provide all that they need in terms of, let's talk about well-being, right? Rather than fixing a broken leg or a disease, right? So what we're talking about today, I think there is a recognition from people that more support needs to be given, but perhaps, they would say themselves, even perhaps it's not something you would get from a GP visit or a trip to an acute hospital. But people do need to be led, steady. They often don't have the solutions. They can describe the problem and they can start to say, I'm not just talking about more doctors in a hospital, but we, the sort of people on this, all of us on this call and this community, who think about these problems every day, we need to come up with the solution, which I think, I suppose, in a very rambling way, I'm saying it is community-based interventions, which takes us right back to the beginning, because that is what HEC is doing. It's doing research into community-based interventions. So I think people would love it if they can go to this idea of a kind of one-stop shop that's been talked about a little bit today, which is, I go to I might go to a coffee morning or a gardening club or whatever it might be as the main thing. But then when I turn up there's almost like a multidisciplinary team who can help me with, employment issues, mental health benefit claims. That is right, and people do talk about like that extra kind of community support that they like, and they like those kind of settings which are very accessible and probably more approachable than turning up. Even if a GP's clinic could do it, right, there are other barriers to that. The challenge, of course, is, and all of us working in voluntary groups know this, is when someone does turn up, how long have you had to have 2 or 3 multidisciplinary experts sort of on standby there, in the hope there might be some people they can help? Because if you don't get the utilization of those experts in their field, then the business model, the business case will never add up. So I think there's quite a lot of creative thinking, and I bet, actually, Sedi, huge amounts of it have already been done by people on this call. And that's another valuable role of HEC, isn't it? That we can look at what's working, what's been done in Kent, not try and reinvent the wheel. Look at Britain, look at Europe. We're very similar to most Northern European countries, at least. There's huge millions, hundreds of millions of people, and learning from that as well, I think would be very valuable. But I suppose the key thing really is, I think, some innovation, some disruption, and some new ways of delivering services and funding them are absolutely critical, and what people out there in our communities want.
Thank you, Dan. Thank you so much. And on behalf of us all, certainly Alice, the team, and myself, thank you for the time you've given us today. I'm conscious you are extraordinarily busy, and give up the morning to join this conversation, take away 1 or 2 things which hopefully you'll continue discussing with colleagues, is very, very valuable. And thanks to Teresa, who couldn't stay for long but made a really valuable contribution.